Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Grace Torres-Hodges. She's a podiatrist. Her Kevin MD article is titled Breaking Free, The Power of Physician Autonomy in Patient Care. Grace, welcome to the show.
Hey, how are you doing? Thanks for having me.
Great. So first, let's briefly share your story and journey to where you are today.
So I am a podiatrist, a foot surgeon here in Pensacola, Florida. I'm owner and founder of Torres-Hodges Podiatry. We've been in business since 2001. I did my undergraduate schooling at the Vanderbilt. I didn't go direct. I actually worked in Washington, D.C. for a while before finding medicine again through a sports medicine mentor I had in grad school, and found podiatry, went to the New York College of Podiatry, New York College of Podiatric Medicine in Manhattan, did my residency training in podiatric medicine and surgery at St. Vincent's in Jacksonville. And I actually came home to practice in Pensacola because both my parents practiced here also. One of the reasons why I didn't go into medicine immediately is because I thought they were pushing me. So I had to kind of find it
Sure.
myself. So ironically, autonomy has to be felt within yourself first before you really feel like you want to go into it. I've been in practice, like I said, since 2001, and went through all of the changes that a new practitioner would normally go through. Doing well practice-wise, clinically, and financially to stay afloat in a solo private practice. 2013, Obamacare and the ACA came in, and things were changing, and things were changing already as it was switching over to e-prescription, switching over to EMR and everything like that. And long story short, and this is something that many of your listeners probably also felt, it's the overwhelming strain of third-party and insurance-based medicine. I went to a meeting in 2013 that opened my eyes to the free market medicine movement, which was mainly direct care. And it was mostly with direct primary care. And as a specialist, because our care is so episodic, it's like, how in the world do you do that? I found a way, just like going through it, found others that had already done it. So one of the biggest things is always looking for a mentor.
Yeah.
And I had some great mentors along the way. In 2017, I went 100% cash free. It was a very strategic transition. I am very happy with the way that I'm practicing now, and it's much more stable. My patients benefit from it also, which is probably the biggest plus. It's relationship medicine again, and I'm open to do more of what I want to do, not
Yeah.
only clinically but also in my private life. And so that's my thing. The article that I submitted to Kevin MD has to do with finding that, and I use the term of compass, finding that way of finding your way back into it. That for me, direct care it ended up being a way to find physician autonomy again.
Sure.
And so that's basically what I am right
Yeah.
now.
So your Kevin MD article, which you talked about your journey breaking free to power of physician autonomy in patient care. So talk about your practice today. What's it like? So it's a insurance-free practice. Is a direct pay practice. So
It's a
tell me.
direct pay practice. Yeah. It's a direct pay practice, unlike because of the type of care that I do. And I do a full scope of podiatry, conservative all the way to surgical intervention. I'm on staff at all of my local hospitals, including the Andrews Institute and Gulf Breeze. And so basically, it's my aha, probably the best way to do this is my aha moment came when I had to deal with the plumber in our house,
Mhm.
and how easy it was for me to get what I needed and for the plumber to be able to be satisfied in his business. And long story short, what do? You call and ask around on your social media, your friends, family, who do you use? You call them up, make an appointment, have them evaluate and assess. They give you an actual price, an estimate on it. They give you a quote. You make the decision. It's up
Yeah.
to you to make the decision. When you decide to go with that individual, basically you let them do their thing the way they want to get it done. You've already agreed on a payment. You pay them. Everybody's happy in the end because you got your thing fixed and they got paid for doing their job at the value that they priced it at. I couldn't figure out why we couldn't do that in medicine. And really, that's basically what it comes down to. I had lots of conversations with patients who I got frustrated for because of the fact that everything was so delayed for
Yeah.
them. and we'd find other ways out. The medicine gods basically kind of helped me because so many promising and innovative treatments are typically never covered by insurance to begin with.
Yeah.
I do laser, I do a lot of aesthetic medicine in here, a lot of preventative care, which I think they assume in third-party payers just to be included in the thing. You still have to use your head. There's that phrase that said, don't pay me for the time that I spend. It's for the years that it took for me to get like that. And that's where the third-party insurance folks, there's a disconnect
Yeah.
over
Yeah.
there. And as a result of that, now my practice is all my prices are listed online. Because of podiatry being episodic, it's kind of hard to do a membership base, which is what the DPC or the direct primary care models were always based on. So you treat it almost like like I said, like a mechanic, like a plumber, like just on when they need it. You can bundle. The nice thing about it is that you're not restricted by any kind of protocol. It's your protocol. So for instance, in my case, I offer bundled services when it comes to things like series of treatment protocols, like for lasers, for musculoskeletal, or for nails, or surgeries. If I'm doing more than one procedure on a foot, we can bundle it. Why do I have to charge for each one individually? I have a relationship also with the facilities that I work with. My biggest thing that I tell patients all the time is ask for cash prices, because people don't see the price when you're not the one paying, and the fact that there's an onus on the part of the patient. My patient base right now is so much healthier. There's a lot more preventative care, proactive care, because they have a stake in it themselves. The contrast on that, everybody always will ask, well, then you must not care about poor people. And actually, because my time in the office is more intentional, I actually can volunteer my services outside. So before, when I was in insurance-based practice, I didn't have any volunteer time to dedicate to our local. We have a lot of, every community has an indigent clinic, and I have time to do that now because, my time in the office is intentional. I can then spend time elsewhere and offer services there. So it works out. It's a plus, win-win all the way across.
How difficult was it to build up your patient panel? Because as a primary care physician, if I referred a patient to a podiatrist, of course, they would have the option of going to the in-house podiatrist that's affiliated with a certain medical center versus someone who is direct pay. So from the patient standpoint, talk about the choice that they were facing, and was it difficult to build up a patient panel given that patients were confronted with a choice?
It really, I'm coming from an established practice. I was 15 years in practice already, with a name, with a reputation. Coming into it, the hardest thing was to see many of my patients leave originally, because when you tell them that I'm no longer taking insurance and that you'll have to pay out of pocket, the idea is still foreign to them.
Yeah.
It's changed tremendously just within probably the last 3 years. It's changed tremendously. But, that's one of those things. You never want to feel rejected by people that you've been taking care of for a long time. But with regards to your question, just like when I hate to say it like this, but when you're buying a TV or buying any kind of service, you look at the outcomes, you look at the patient satisfaction, you look at, or the reviews and everything like that. Let your work speak for itself. The pluses with going with any specialist or a physician outside of a system, there are no protocols, and the delay that it takes in order to get into someone that's in network versus sometimes same day visits with me, that's night and day. Case in point, I'll use an example of a fractured foot. So I have many patients that 80% of my patient base still has insurance.
Yeah.
The thing is, they choose to come and see me. Why? Because they believe that the care that I'm giving them is something in line with what they want out of their foot care. I had a patient who dropped the meat dropped from her freezer onto her foot. She could have gone to the emergency room, have it covered by her insurance, but you call me and I can do it all within, and she actually texted me, I can do it all within a 30-minute visit. I've got the x-rays here, I can take care of it. And the cost is not just financial, it's their time also. So there's a lot of value that people have to understand when it comes to their care that is given, that's just not money driven. It's also, how they feel, the satisfaction they feel, the trust that they feel. And I really love the fact that direct care is getting back to relationship and the essence of what we do and why we do it.
Sure. So you've worked both with, of course, the insurance system and then a system without insurance. Contrast your days under those two systems.
The insurance-based system, initially when we got into it, you think, especially when you're a new practitioner or, coming straight out of residency, you think, oh my gosh, I'm getting on all these plans. That's how I can get my patient base.
Yeah.
Yeah, the network is there. You have a steady stream of it, but the price for your services is dictated by the fee schedule. And unfortunately, as years went on, the fee schedule got less and less and less. And the cost of running a practice kept on going up and up and up. There's that disconnect there that you're unable to manage. So when you think you could only see, 20 patients in the morning, now you have to see 30 patients, just to make up the difference of the lesser reimbursement, just to cover your expenses. In a direct care practice, all my pricing is based on what it costs for me to run this practice. Just like a mom and pop store would figure out in a restaurant, in a storefront, as a mechanic, as a plumber, any of those industries, we do that in business everywhere else except in healthcare.
Yeah.
And so my time with patients, they have same day, many times visits or within a day. They have access to me 24/7 because they can email or text me directly, particularly those that are already established. There's not a constraint to staying in the office. Many times for my established patients, I can do home visits. I don't have to see as many patients. My average day is 10 to 12 patients. It is much more manageable. I don't have all of the extraneous paperwork and protocols of, did I note this in my note? I mean, the beautiful soap note that we all learned how to do when we were in medical school,
Yeah.
is really intended for yourself. It's for the doctor. It was like your notes, but because it became part of the third party payer, now you have to put in things that have nothing to do with your specialty many times.
Yeah.
And that just takes up time. I get to go home at night. I finish my notes during the day. Just that and alone, that saves you on your home life and everything. But it's just a cleaner way of doing things and a more streamlined, efficient. Your staff loves it also
Yeah.
because they are not on the phone half the time or half the day with a carrier. So, again, I'm a big advocate for direct care.
Sure. How big is your office staff?
I have two staff members. You don't have to have extra people. I actually, we did downsize as a result of getting out of insurance because I didn't have to have someone that did all the referrals or did all the follow-up because again, they're spending most of their time on the phone.
Yeah. Do you
Mhm.
find that your relationships with your other physician colleagues has it changed ever since you left that insurance-based model and you're not affiliated, particularly with a specific medical institution? Did you have any changes in the referral patterns? And did your colleagues just ask you, why are you doing this? Describe the relationship that you have with your other physician colleagues in the community.
I'm very blessed. I have a good relationship with my referral base here in Pensacola. The first time when I mentioned it, because I'm one of the early adopters to direct care, particularly as a specialist, they all thought I was crazy. I think deep down they were wishing I'd succeed, but they
Hmm.
were thinking, "Oh my gosh, she's going to go out of business. So poor Grace, she's going to, she won't be able to do it." They are not envious, but they're happy now that I've done this because there's a path to follow.
Yeah.
As far as the referral patterns, they really didn't change. I was very attuned to educating both my patients and also my physician referrals. It's important the physician understands that it's not them.
Yeah.
It's always the patient's choice. I said, you know what? Let the patient decide. I know it's not you. If you feel like I'm the one that can take care of them, because we have so many other great podiatrists in town to go to. And let the patient decide if they want to come to me, this is the way it is. If they want to stay with someone in the network, that's fine also. There's nothing different about the training. There's nothing different about the medicine that we're going to offer. It's the method in which it's going to be. The payment of it is secondary. you know, there are barriers when it comes to the networks. There are fewer barriers without. So I think anyone that goes into a direct care practice, especially if you're coming from an established practice, maintain those communications with your other physician colleagues. They know, they understand, they can feel it also. And so maybe you might be able to inspire them also to escape.
Have any other physician specialists followed in your footsteps and went to a direct care model?
As a matter of fact, there have been. When I first started this back in the transition back in 2013, 2014, after that exposure to a meeting on social media, I got on there and started getting involved in a lot of the Facebook groups,
Mhm.
LinkedIn groups, and other things. And through that network, there were so many people that reached out to me. So much so to the point where I actually formed a corporation to help other doctors, mentor them through. There's a huge mindset change that you have to go through with this. We are, unfortunately, the training that we got in medicine is top notch. You can't contest that. The problem is it was so regimented we didn't know how to escape it. There's a Dr. Arlen Myers is known to have said we're conditioned to conform,
Mhm.
and the importance of maintaining independence. You didn't want to stand out when you were in med school, as far as, because you were afraid it may impact how you get into residency. And then when you were in residency, you wanted to stand out, but you didn't want to do it in a way that looked like too much, because then you might not get to go on that case. I mean, there was all that back and forth. But then when you get out in the real world, you really have to actually stand out in order to do your thing. But we forgot how to do that, because for many of us, that's, undergrad, and then med school, and then residency. Minimally, there's at least 7 years. Then you go into fellowship for so many. That's indoctrinated in you. So we need to find that back, and that's what a lot of what I do is work with other physicians to help kind of mentor them back through that process, to find that independence, to find that autonomy. And so there have been so many. There's a movement now. For the longest time, there was only just direct primary care. Now we have direct specialty care.
Yeah.
There's actually an alliance. Two of my friends, Dr. Granita and Dr. Kenny, both have started that. And so I think you're seeing that really expand. And after the pandemic, when there was such a stark awakening of the dysfunction in practice, particularly in the private practice sector, I think you're seeing that movement change.
We're talking to Grace Torres-Hodges. She's a podiatrist, and her Kevin MD article is Breaking Free: The Power of Physician Autonomy in Patient Care. Grace, for those specialists who may be listening to you now and thinking of perhaps transitioning like you to some type of direct care practice, tell me, what kind of questions should they ask themselves to make sure that this is the right path for them?
You know, uh, Talk to their patients first. Well, number one, look at your books. You have to be financially, especially in private practice. And I'm going to address it as a private practitioner, or private practice physician. If you're transitioning from an employed position to private practice, there's a whole slew of things that we would help you get through, because that's a major change from going from being dependent to completely independent. But for those who are currently in an independent private practice, look at your numbers. You are a small business, and don't forget that.
Yeah.
It's important that you have to make sure that your ins and outs, just like when we're balancing it in a patient, are matching and staying above where it should be. Talk to your patients and see if there are things that are causing your patients to leave you. That's one of the things. Ask yourself, what do you want out of your practice? What do you like to do? What do you feel you're the best at? Start with those questions: your finances, your patient's needs, and what you want to do. And then that's always a good starting point. Now, it's not easy. There's work
Yeah.
with this. It is not a switch that turns on at night. It's definitely a transition. There are those, myself, it took me almost 14 months to get back to the same financial level I was at prior to dropping everything. More recently, I have a friend in Texas who was able to do it in 4 months. He was
Wow.
smart. So there are so many tools now available to do that. But I think, talk to find it within yourself and look at internally, analyze your own practice first. That's the key thing. And know your patient base. Work with the ones that are already with you. They entrust you with with their care. You want to help them. You already have that relationship. Take advantage of that.
And my final question, Grace, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Probably, I've got two. All right. So the first one would be healthcare doesn't equal health insurance. That's something that I think both physicians and also patients have to understand. Healthcare is what we render to individuals to improve their well-being. Health insurance is a risk management tool and a means to pay for it, but not the only way to pay for it. That seems to get mixed up all the time and traded off. And then the last thing and most important for me is know your worth. As a physician, you've gone through so much training, your skills, your knowledge is what your patients are seeking, and that's what you're offering to them. And there's that phrase by Hippocrates from his book of epidemics called "First, do no harm." How good can you be in doing no harm to someone if the system is harming you? You don't have to change how you practice medicine. You just have to change how you interact with the system, because the current system right now is so dysfunctional. So I hope your listeners can find something like that makes them happy, find their autonomy back, because it's all in us. Those would be probably the two that I want to mention.
I understand you have a book coming out. Tell us a little bit about that.
Yes, thanks. I do have a book coming out. It's actually called The Private Practice Solution. It's a guide for doctors to reclaim physician autonomy and to restore the doctor-patient relationship. We're in the formatting and layout stages right now. So if you go to my website, drgracedpm.com, and I will share it also with you, Dr. Foe, you can stay up to date on when it will be released.
And always welcome to have an excerpt on Kevin MD and then come back on a podcast and we'll talk about that. Well,
Sounds
Grace,
great.
Thank you so much for sharing your perspective, time, and insight. And thanks again for coming on the show.
Thanks for having me.